most famous physical therapist on the internet.
Hi, folks. I'm Bob Schroe, physical therapist.
Brad Heineck, physical
We're the
therapist.
most famous physical therapists on the internet.
In our opinion, of course, Bob.
We're going to show you how to stop hip bursitis pain without seeing a doctor or having an injection.
Right.
We're certainly going to give you some advice here on things to try before you go that far. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, join us on our website, bobandbrad.com, because right now, once again, we're giving away a huge product this week. We're giving away the Teeter Inversion Table.
Right.
This is really a cool table that you can use for decompression. And Brad and I are just amazed. It's made by a guy named Teeter.
Right.
I mean, what are the odds that, it teeter-totters?
Roger Teeter.
Yeah. How is it that he came up, to have that name and to come up with that product? By the way, also you can find on Facebook, Bob and Brad. Want a short version of us? Go a 60-second version. Go to Instagram or Twitter. We do it every day.
There you go.
We never stop. We're like a hurricane. I don't know. We're like a juggernaut. There we go.
You're babbling, Bob.
All right.
Now they're going to holler at us.
All right.
Okay, Bob, this is why I wanted to do this.
Okay.
2 reasons. We did a nice video on this 6 years ago. I looked at it. It's a little blurry. There was some information that we can add to. So that's one reason. The other reason, I was doing some research on it. And almost all the research I could find was talking about injections and all this invasive, aggressive treatment you need to go to the doctor for. And I really think that if you approach it properly, you can avoid all that and get rid of it because bursitis can be real debilitating. It limits your walking, hip pain, etc. But if you understand
it, affect your sleeping.
Oh, right.
Yeah.
We're going to show you why it happens. There's something called an IT band that comes down here, and you have some other connective tissue that goes over the greater trochanter, this part of the hip. And what happens is when you walk and you move, the tissues slide back and forth over that bone. Now, if there was no bursa there, a bursa sac, that would become very painful and things would wear out very quickly. So what we have is a bursa sac, which is represented by my little piece of paper here to allow it to slide back and forth real easily. If this bursa sac becomes inflamed and irritated, that's where the pain is. That's the source of pain right there. So we need to get the pressure off of there, allow it to calm down, heal, and get back to life.
Yeah, the thought process is, Brad, we believe that if you have what we call a Trendelenburg, like you kind of walking with your hips waddling back and forth,
Sure.
That's putting increased stress on that on that bursa also.
Right.
So we want to, at some point, strengthen things. Or should I jump to this one, Brad?
Well, go ahead, Bob.
Actually, if you use a cane right now, that can stop that waddling from occurring, and that can also stop some of the stress on the bursa.
Right.
So quite often, what you do if you have bursitis just in one hip, let's say I have it on my left side, you're going to use the cane on the right side.
Sure.
We won't go into the mechanics of that. There's a whole physics behind it, right?
But it's true. It takes pressure off the opposite hip.
So when you're moving the left foot forward, you're moving the right cane forward at the same time, and that'll help straighten things out, and it'll definitely take some of the stress off. And a lot of times, if you can calm things down, it stays calmed down.
Right.
I'm amazed at how quite often just a cane can make a big difference.
Yeah, we do this with our patients.
Yep,
have them use
all
a
the
cane.
time.
The pain was at a 6 before. Now it dropped down to a 3 just with the use of the cane.
Right.
It's a temporary thing.
Yeah,
it's not like you're going to use it for the rest
That's
of your
right.
life.
We're not saying that you're bound to it.
Right. That's one of the options you can do. Now we're going to give 4 options and then some exercises. The second one is simply, if it's irritated and sore, get yourself a cold pack. I brought mine out like this, but Bob says you got to have a bigger one than that.
Come on, what is this?
Well, the bursa's not that big.
Little girly man.
You could use one like that, but yeah, if you got a big one, get like this, and you can lay on your side. This will make my sore hip. You could do this in a recliner, but you need to get that cold pack directly on your hip. But make sure you have some layer of clothing. I just had a patient yesterday. He got burned from a cold pack.
You did?
Yeah, he didn't have the layer of clothing.
Right.
So you got to be careful. 20 minutes.
It's like frostbite.
Right. Exactly. 20 minutes on there, and that should help calm that down as well. Number 3 is avoid activities that irritate it. So if walking irritates it, you're going to obviously have to walk, but you're going to limit. You're not going to go on long shopping sprees or go out for a walk and think you're going to walk through it.
That's where the cane might help. It
Yep.
might help you walk further. But the other thing that is very common, quite often, they'll have bursitis
Mhm.
and they tend to sleep on that side. So
Right.
you definitely want to avoid sleeping on that side. Let's say you're avoiding it, but you still need to do this adjustment. Otherwise, you're still putting stress on it. So let's say your bursitis is on the right side here, on the upper leg, and you're doing the right thing. You're not going to sleep on it. Well, if you take this pillow away, this leg rotates and it pulls over on the hip bone here. The muscles do. So you definitely want to use a pillow between your legs, and that'll take the stress off that area and it'll help it calm down. Get that good night rest, and it's going to allow your body to heal a lot better and faster.
Right. And then the other thing that you can do, it just depends on you. If you respond well to NSAIDs, like ibuprofen, take that for, I don't like to take those long term. I think if you do it 3 times a day for 3 days in a row, it's going to do what it's going to do. And while you're doing these other things.
Yeah, and you have to make sure you're allowed to take them.
Yeah.
But we've had pharmacists that recommend that you might take kind of a higher dose. And you should ask your doctor or pharmacist,
Right.
but take a higher dose for 3 days and then just stop.
Right.
So and really try to blast it. But
Always take those with food. But again, get that okayed with your doctor so you're not
NSAIDs, non-steroidal
Anti-inflammatory.
anti-inflammatory drugs. These, right?
anti-inflammatory
We just call
drugs.
them
NSAIDs.
NSAIDs.
Yeah. And
Anti-inflammatory.
right. Ibuprofen's probably the most common.
Right.
Now let's get to the exercises.
Sure.
Stretches. Okay.
So we're going to try to stretch to take some of the stress off that bursa.
Right.
So there's not as much pressure on it.
Now these stretches you won't get too aggressive with, depending on how inflamed it is and how sore it is. But this is one you can do this seated on the floor or a bed or even your couch, and you cross like this, and you're gonna pull this knee across your body like this.
Yeah.
You can see this right here, the white stripes on my pants represent that IT band and some of the other tissues that are going to cross that bursa, and stretch them out. Now, if you do this and it hurts and it's so inflamed it hurts, you need to rest.
Right.
Don't do it. It should just feel like a nice, comfortable stretch. Hold and do this, 5 to 10 times, and it should feel good. And give it a break. Do that 3 times a day. The other one is you lay down like this with your knees up. You can have a pillow. You can do this one in bed easily. And you put your right ankle just below your left knee like this. I call it the figure 4 stretch. And then you're going to bring your left knee, my left foot comes off the bed, and you pull gently like this. Don't get too aggressive with it. Should be relaxed. And hold and stretch.
How about, Brad? Let's say you're just unable to do those. Let's say you're not as mobile. I mean,
Right.
you could just start off like this and bring it over and give it a good stretch
There-
like that, keeping your back down, keeping everything and allowing it to stretch that. This is kind of a gentle, good start stretch.
That's a good
So-
point, Bob, because we do have, particularly some of our older people, do have a hard time. This
Get
is
into those positions.
thank you.
That's a real pretzel there.
Yeah.
So there's also the standing wall stretch. Should I
Sure,
show that one?
You bet.
So you could try this one too if you're maybe a little less flexible. So you go up against the wall. You're going to be about, I don't know, I'm about 3 feet away from the wall. It's going to depend on your height. I'm going to lean on my forearm, and I'm going to stretch this one, the right one. So I'm going to cross this one over like that. And then I'm just going to lean like this. I'm going to lean my pelvis into the wall. And so this is one most people can do. I mean, a variation of this is just to go ahead and lean this way
Sure.
and not even cross it over. But I always find it a lot easier. It's more stable and it's
Right.
just easier to do. So obviously you'd do both sides too. You'd cross over and go like this too. So you
Good
can see
point.
both angles.
Yeah. And you're going to spend, a minute or two doing that stretch, and you can put the pressure on, pressure off, and work with that. What was I going to say about?
I was funny. I was just thinking of a joke. I think this was Reader's Digest. A lady was stretching it, and she was going against her car, and a guy comes up to her and starts pushing the car with her. He thinks that she's
helping her out.
yeah, yeah, gets stuck. This is Minnesota, you know. That's
Yeah,
what's going to happen in Minnesota.
right. Yeah. Or I suppose they're going to try and push
Try
the
to push the
over.
wall over for you. So
Now, the other thing, we got a strengthening exercise to get those muscles strengthened in that area. This works good if you have one of these loop bands like this and it stretches. I'll show you. You can start without one of these.
yeah, I in fact would recommend you do start
Yeah.
out without it, because these are small muscles, and to build them up, you want to do a couple reps for a couple weeks probably. If you jump right into the band like I did, and I was doing every day, mine got a little sore.
Got a little
So
slower.
yeah,
So you're going to lay like on your side. So this would be the involved side. Things are starting to feel better. It's a little calmed down. We want to start strengthening. And we call this the clam shell because it looks like clam shell.
yeah.
So and you're not going to do them real fast. It's up and then bring them down. And if you can, keep a gap between here. Don't let it touch and rest. Up and there, you got an inch or two in between there. And at about a pace like this, you're going to do 10 to 20 of them. You'll feel it. As a matter of fact, right now, I can feel that muscle right there. Like Bob said, we're working some small muscles. We're not doing the glute maximus here.
Yeah.
And when you get tired, you give it a break, and then you can do another set of 10 to 20. You can do 3 sets of those as long as it's not too much. When that gets too easy, you can see I've got my little loop band right here.
He moves it down.
Yeah, put it down by your knees, and that'll definitely give you
Yeah,
the
now
extra
you're
resistance you
working.
need. Yeah. And you're going to probably cut down to 10 repetitions.
These come in different colors. Generally, the lighter the color, the easier it is. And,
Right.
like you get up to black, and
Yeah.
that's where you start.
Oh boy, I can feel
No,
that
I
baby
mean,
working.
I was
That-
using black. I went right to black, and
Oh.
I'm in good shape. And I was doing it every day for a while. Like, oh my God, I
Yeah.
got so fired up. I couldn't sleep on that side. I had to ice it. I had to
Well,
massage it.
that's the price you
So-
pay for being a man.
Yeah.
It's a guy thing.
What does that mean?
It's a guy thing. Guys
All right.
always overdo it.
Oh
you know?
yeah, sure. Yeah,
That's what I
we're
meant.
idiots. So, remember, Brad and I can fix just about anything.
Except for.
Broken heart, but we're working on it.
Good luck.
Thanks.